Let's get right into this explainer because a massive shift in Medicare policy is literally right around the corner. If you or maybe someone you love is on Medicare and managing obesity, you already know the frustration. Navigating the sheer out-of-pocket costs of modern weight loss medications has been just brutal. But a brand new program, the Medicare GLP-1 Bridge, is officially launching on July 1st, 2026. Today, we're going to build your ultimate patient playbook so you are 100% ready to take action. For years, Medicare's hands were completely tied. By law, they just could not cover these medications for obesity, which left patients staring down staggering bills, sometimes over $1,000 a month out of pocket. It's been a massive roadblock. But starting July 1st, eligible beneficiaries will pay a flat $50 a month. $50. That is a real number, and it's an absolute game changer for access. So, to make sure you're fully prepared, we'll quickly cover the $50 bridge itself, which specific drugs make the cut, the clinical rules to qualify, your exact 4-step action plan, and of course, the fine print. Let's get to it. Section 1, the $50 Medicare Bridge. Let's look at how this historic shift in coverage actually functions in the real world. What's really fascinating here is that this program is essentially a giant government workaround. Thanks to a 2003 law, Medicare is statutorily banned from covering weight loss drugs. So CMS, the Centers for Medicare and Medicaid Services, created what they call a demonstration program. It operates completely outside of your normal Part D prescription plan. Think of it like a dedicated express lane built entirely for obesity treatment. Here is how they actually pull it off. CMS contracted Humana to use their massive national infrastructure to act as a central processor. Because of that, your current drug plan doesn't even need to opt in for you to use it. The government stepped in, negotiated the actual cost of these drugs down to $245, and you only pay $50 of that. And honestly, the best detail? That $50 copay is locked in, whether you're on a tiny starting dose or the absolute maximum maintenance dose. Moving right along to Section 2, which drugs are covered? We really need to clear the air here because the famous brand names you constantly hear on the news might not be the ones this program pays for. There is a very strict divide to remember here. The bridge strictly covers formulations explicitly FDA approved for weight loss. That means Wegovy, Foundalo, and the Zepbound KwikPen. And yes, I said KwikPen only. Those single-dose vials of Zepbound are totally out. On the flip side, it completely shuts out diabetes medications like Ozempic and Mounjaro, and there is absolutely zero coverage for compounded GLP-1s. It is incredibly specific. The big takeaway here, you cannot double dip. If you're already getting a medication like Wegovy covered for cardiovascular risk or Ozempic for type 2 diabetes, your coverage stays exactly where it is in your regular Part D plan. Nothing changes for you. The bridge is strictly a new doorway exclusively for folks treating obesity itself. All right, Section 3, do you qualify? Let's tackle the BMI and clinical tiers to see if you actually meet the rigid medical requirements for that $50 copay. You can go ahead and breathe a huge sigh of relief right here. Your eligibility hinges on your body mass index the very first day you initiated therapy, not what the scale says today. So if you've been paying out of pocket or using commercial insurance for years and you've already lost the weight, you are not penalized for your progress. How great is that? Let's break this complexity down into 3 distinct eligibility tiers. Tier 1 is super straightforward. A starting BMI of 35 or higher gets you in. Tier 2 requires a starting BMI of 30 plus a specific condition like heart failure, kidney disease, or uncontrolled high blood pressure. And note that uncontrolled means it's above 140/90 despite you taking 2 blood pressure meds simultaneously. Finally, Tier 3 is a starting BMI of 27 plus a severe history, like prediabetes, a prior heart attack, or stroke. The devil is really in the details here. Beyond just the numbers, you've got to be enrolled in an eligible Part D or Medicare Advantage drug plan. Plus, your doctor has to formally confirm they're prescribing this specifically for weight management, alongside structured nutrition and physical activity, exactly as outlined by the FDA label. This isn't just a bureaucratic hurdle. It's literally how these treatments are medically designed to succeed. Okay, Section 4, the 4-step process. We know what it is. We know who qualifies. Let's map out your exact action plan to get this medication in your hands. Here is your step-by-step strategy. Step 1, confirm your Part D enrollment. Step 2, make sure your original starting BMI is properly charted. You need to have a proactive conversation with your doctor way before July 1st, so their office can get the electronic prior authorization paperwork prepped and ready. Then, Step 4, you simply pick up your prescription for $50.
According to official CMS prescriber documents, the beauty of this system is there's no paperwork for you to physically mail or upload. Your doctor's office handles everything electronically on their end. They submit it directly to the central processor using specific diagnostic codes, and they literally have to annotate the prescription with the phrase "send to Bridge," so the pharmacy knows exactly how to bill it. I cannot stress this next point enough because it is a very common trap. Do not call your Part D drug plan for this. Remember, this is a separate federal workaround, meaning your normal drug plan is sitting completely on the sidelines. If your doctor accidentally misroutes the prior authorization to your normal plan, it is a guaranteed recipe for rejection. It absolutely must go to the bridge processor. Which brings us to our final section, the fine print. Here's what you need to know before you start, because a $50 copay does come with a few major structural catches. For context, the out-of-pocket cap for Medicare Part D in 2026 is $2,100. Usually, once you hit that cap, your drugs are completely free. But your bridge payments, they do not operate the way you might naturally expect. Because the bridge exists entirely outside of Part D, those $50 monthly payments will never move you closer to your annual out-of-pocket spending limit, your TROOP. Furthermore, standard manufacturer discount cards, coupons, or even low-income extra help programs cannot be stacked to lower this price. $50 is the absolute floor, guys, even if you are on dual Medicare and Medicaid. You also need to go into this with your eyes wide open. We all know obesity is a chronic disease requiring long-term, ongoing treatment. But this specific access pathway, it has a hard expiration date. It's a temporary demonstration, not a permanent change to the law. This timeline perfectly illustrates the urgency here. You essentially have an 18-month window on the bridge starting in July 2026. After that, the entire system undergoes another massive shift to something called the balance model in 2027, and the bridge closes down. When that balance model officially takes over, the rules change entirely. The workaround ends, and the coverage moves back inside standard Part D. But here is the massive kicker. It will be completely voluntary for individual drug plans to participate. That means your specific plan choice during this fall's open enrollment will dictate if you get to keep your medication access next year. You have to be strategic. Look, this bridge program is a monumental crack in the door for treating obesity as the chronic disease it truly is. It's a tremendous opportunity, but it demands preparation. So get those doctor appointments scheduled, verify your starting BMI in your charts, and ask yourself right now, what is your strategy to secure your long-term health as we head into open enrollment this fall? Thanks for joining me on this explainer, and I'll catch you on the next one.